sit on the Durango Network Board, which is independent providers in our community, as well as the Chamber Board, and all of those entities came together for this health initiative. So that's why I sit on the steering committee.
Thanks. And Nan Penzruder?
Hi, yeah, this is Nan Penzruder, and I'm a volunteer on the Southwest Health Advisory Committee. I joined in July of 2019, and my background is all in health insurance, mostly on the inside of the house. So think of like the pricing, the underwriting, the actuarial type work. So I volunteer those skills. We've got a really good, diverse committee here. Thanks.
Thanks. And Elise Nyerlin, Peak Health Alliance, is on the call. She's going to help us present. Maybe you could introduce yourself, Elise.
Hi everyone, I'm Elise Nyerlin. I'm with Peak Health Alliance. I'm the Director of Outreach there, which is really a jack of all trades. So I'm the point person for Peak Health. When you chat us on our website, or if you send us an email or give us a call. And then I also am the point of contacts for providers and brokers. And I am zooming in today from Silverthorne, Colorado, in Summit County.
Thank you so much, Elise. Claire Brockbank is here. We're so lucky to have Claire today. Will you introduce yourself, Claire? Let's see, maybe she's on mute. Wow, there's so many folks I can't actually. All right, Claire, we'll come back to you. How about Ted Wright, who is on the Local First Board? Will you go ahead and introduce yourself?
Hi, I'm Ted Wright, and I'm on the board of Local First, and a local attorney here in town for a number of years. And I'm here with my wife, Jill, who's very interested in this program because, you know, I have that wonderful Medicare program already.
Good for you. Thanks, Jill and Ted. Tim Wheeler just joined us. He's on the steering committee for the Southwest Health Alliance and the Local First Foundation Board. Tim, we're just doing some very brief introductions so folks can see kind of the leadership and the partnership that we have here. So if you could say hi, that would be great.
Hi, everyone. I'm on the Local First Board and also the steering committee for this, as well as the Local First Foundation Board, and welcome you to hear about some really good, incredible things that this group and Local First Foundation have done. And I want to thank everyone on this steering committee who's plowed through this for the last almost 2 years.
Great, thanks so much, Tim. And I do want to just take a moment. You're going to see more about the different roles that all of these individuals and organizations play, but to just thank Peak Health Alliance for the incredible support they've given our community. I think we've all had our head down, so to speak, making what you're going to see some incredible progress in this region, and none of it would have been possible without the expertise and help of Peak Health Alliance. So I just didn't want that to go understated because really it's been a team effort. So, and if Claire wants to say hi, go for it. You'd have to unmute, otherwise we'll get going with the presentation here.
Hi. Thank you for all the great work you guys are doing. And I realize that while we have been heads down trying to help you guys get launched, I have not listened to one of your presentations. So I'm here to just learn. So I'll go back off mute and off camera, and thank you.
Awesome. All right. Well, I'm keeping admitting folks, although when I go to present, I may have to just check in every once in a while. We've got about 43 people here, which is great. So let's dive in. So we are here today to share some really exciting news. The most exciting thing is that all of us can acknowledge that healthcare is really fun these days, challenging and fun. And maybe that's not always the case. It's been, I think, a challenge for us as a community to address such a complicated system. And we are really pleased to show the partnership and work that we've done to really bring affordable healthcare and high quality local healthcare to all of you in the La Plata County region. So thanks for joining us. A very quick overview on the history of how we got to where we are today. Local First is the voice of the local independent business community in La Plata County. The Local First Foundation works in the broader region of La Plata County and all of the really associated and adjoining counties. We heard from our business members a couple years ago that the cost of healthcare was crippling the local business community in particular, and that it became even more of a challenge that it had been to retain employees and have good healthcare coverage. And we got asked, what are we going to do about this issue? And quite honestly, I didn't have a healthcare background, still don't, but folks on this call do. I know more than I did a couple years ago. And we decided that we should tackle that issue. And we did so in partnership in the very beginning with the Durango Network. And that's an important piece of the puzzle, because the Durango Network, if you're not familiar, are local independent healthcare providers here in the community, not just in Durango, actually in La Plata County and Archuleta County. And we felt that it was really important to partner up with the healthcare practitioners themselves who have that insight into the healthcare system and make sure that we had a good, knowledgeable team. We received funding from the Rocky Mountain Health Foundation and conducted focus groups. And all of that culminated in a community needs assessment that demonstrated that we needed to tackle healthcare, not just from a business perspective, but really from a broader community perspective. And one of the next steps that was recommended from that community needs assessment was some type of shared pooled cooperative. Well, right about that time, we reached out to Peak Health Alliance in Summit County and learned about what they were doing. And it was an incredible model for us here in our region. And thanks to that partnership, which you will hear a lot more about, we have been working over the last 2 years to be able to bring to you today affordable healthcare that you can shop local for, which is really, really exciting. We now have a steering committee that is a broad representation of the community. They're all volunteer, and we are formally affiliated with the Peak Health Alliance. And we're at home at the Local First Foundation because the work we're doing is not only now for the business community, but in addition for anyone that lives in the 4 counties of La Plata, Montezuma, Dolores, and San Juan, and would be seeking health insurance in the marketplace or off the marketplace. So this is a Peak Health Alliance slide. We thought we'd give you a little teaser because you're going to be hearing more about our progress, but we are really pleased to say that we made it to the top of the mountain, so to speak. We have really good news to share, which is that thanks to the efforts of Southwest Health Alliance and Peak Health Alliance, we are able to enter the marketplace, bring the community voice into the middle of a very complex system, and as a result, disrupt that marketplace and have everybody take a close look at how we can bring prices down for health insurance premiums in particular. And we're seeing on average, premiums come down about 35%. The rates are unofficially official with Division of Insurance. And so we feel pretty good about that 35%. Keep in mind that that is on average, depending upon what type of health insurance you might have had before, and just, you know, personal kind of information about you that you might choose different health insurance coverage. And that's just really an average percentage, but it's pretty extraordinary. And then you will see further on in the slides from Elise and Nan that in addition to bringing the price of health insurance down on average 35%, that Peak Health Alliance and Southwest Health Alliance are going to be some of the most competitive in the marketplace with the insurance carrier or partner, Bright Health. And we'll tell you more about how we got there. So as a reminder, even though we're going to talk a lot today about health insurance premiums and ACA compliant products, we really have a broader mission and goal, which is to provide affordable, accessible, and high quality health care to the citizens of the La Plata County region. And so health literacy is very important to us. We're looking at value added options for the self-funded marketplace into the future. And all along the way, we're upholding these community values. And I want to underscore them because I really do believe that it's the values themselves that allowed us to come together and collaborate and really have the results that you're going to see today. So the first value is that this is a local solution and it's available to individuals and businesses. We're trying to make it available to as many people as possible. It's really important for us to support local independent providers, local self-reliance, and so we bring that into every discussion that we have so that we can minimize leakage in the healthcare system and keep dollars recirculating here in the La Plata County region. Transparency and accountability are fundamental to what we do. Healthcare can be very complicated and not easily understandable, the pieces of the puzzle. So we're bringing transparency and accountability to that table. We're doing that through metrics and data. So you heard from Claire Brockbank earlier with Peak Health Alliance. Peak Health Alliance was extraordinary in their ability to work with us and the steering committee to bring that data to the table and really look at why healthcare is so expensive in our region. What can we do to try to bring that healthcare down to a more reasonable amount? The steering committee is all listed here, and I just want to shout out to thank them for the countless hours that they've spent. Weekly calls at a minimum, sometimes 1 or 2 times a week, and also just wanted to let folks know that Peak Health Alliance does have a healthcare provider advisory committee. These providers that you see on the slides are engaging with Peak Health Alliance to make sure that we have that direct connection with the healthcare providers in our community. As a reminder, the geography for the Southwest Health Alliance is La Plata, San Juan, Dolores, and Montezuma counties. Peak, now in addition to working in Summit County, is also working in Grand and Lake. And I'm going to let Elise talk about what Peak Health Alliance is.
Hi, Monique. Thanks so much. So Peak Health Alliance is based in Summit County. As I mentioned, I'm zooming in today from Summit, and we are a health insurance purchasing alliance. Which is a bit of a mouthful, but what we do is we leverage the community buying power to make healthcare more affordable. Through this model, we're not an insurance company, so we can't pay the claims or bear any risk, but rather we're a negotiating body, negotiating directly with hospitals and high-cost providers to make a difference in health insurance premiums. And I'll get a little more into our model in the next couple slides, but we do this with a data-driven approach. Anecdotally, we know that health insurance premiums have been prohibitive for a long time, especially in our mountain communities. And so we use strong actuarial data to determine the true cost of care and go from there in terms of negotiations. Next slide, Monique. So this is the traditional model of healthcare, how it's been historically. And you'll notice the community is really missing from this model. As it kind of always has been, health insurance companies negotiate prices with hospitals and providers, and that's traditionally a closed-door conversation, right? And as a result of those conversations, health insurance companies set prices for healthcare services and premiums, and then as a result, we all go shopping and it's expensive. So without the community at the table, there has been a real lack of price transparency, and that's what Peak brings to the table. If you want to go to the next slide, Monique. So this is the Peak model, and you'll see how it's different. And we've been working closely with the Southwest Health Alliance to implement this in the Southwest region. So I want to thank them for their work. We start by gathering community buy-in and support, and that's a big part of the partnership that we've been working on with Local First and the rest of the steering committee. After we gather buy-in and support and kind of work on education, we collect and analyze those local claims data. And we do that from the all-payer claims database by looking at claims of residents' healthcare, again, to get a sense of what is the true cost of care to go from there. After that, we negotiate directly with hospitals and providers with the community at the table. So the steering committee has been quite involved in those conversations with hospitals and providers. And as a result, we come up with what is called a fee schedule, or a set of rates that are more affordable and more transparent. We then open those rates for a competitive bidding process from health insurance companies. We select one. Our carrier for 2021 is Bright Health. And as a result of those lower rates that we've negotiated, the health insurance company we select is incentivized to create a plan that reflects those lower rates and as a result has lower premiums. And now we're kind of gearing up for the last step, which is you all as employers and individuals can enroll in these plans on the marketplace, and we'll see the benefits of this model with the lower pricing.
So I'm really pleased to be able to share these 2 slides on what we have collectively been able to accomplish, and to also reiterate that Peak Health Alliance is the health purchasing cooperative that is approved by the Colorado Division of Insurance. Southwest Health Alliance is really the local organizing arm. We're the volunteers on the ground, providing some staff time and capacity to make this happen. And as Elise mentioned, Bright Health, the logo in the middle, is the actual insurance carrier. So that's how all these logos fit together. It can get confusing when you see all of them. So those are the pieces of the puzzle that needed to come together to accomplish basically the reduction that we're seeing across the board on average of 35% across all the carriers. And in addition, we brought a new carrier to the marketplace, Bright Health. And so that gives our community choice. And it's always a good thing when you have choice and you're able to bring additional carriers into the marketplace. And so we're happy to be working with Bright Health. And for the first time ever, you can now shop local for healthcare. So, you know, walking around downtown, you can shop local. And then when you're on the marketplace, Connect for Colorado, Southwest Health Alliance, Bright Health, and Peak Health Alliance represent the locally crafted plan that our community put together for you, business owners, and individuals. And that is a comprehensive plan that Nan and Susie are going to get into here pretty quickly. Also, I really would like to underscore back again to the importance of us being inclusive. Any local provider that wants to work with us and contract with Bright, we are open to that. Elise has done just an incredible amount of work helping the healthcare providers contract with Bright and be part of our network. So we feel very strongly that this should be an open door. And so we're really pleased to announce today that both the Animas Surgical Hospital and Mercy, the 2 hospitals here in Durango and La Plata County, are both part of the network. And we fought really hard and partnered and collaborated to make that happen. And I think it's the values of transparency and accountability that allowed us all to come to the table and partner in this way. So we'll get into some of the specifics here. I know we have Nan on the call. I think Susie's going to take the lead to talk a little bit about plan design, but maybe you guys could collaborate on the slides and I'll just move them forward as you need me to.
Yeah, go ahead, Susie.
Okay, so for the 2021 plan design that we have available, we worked to make sure that we were addressing the issues that we saw within our community, and that resulted in some different plans that are available to you. So this slide shows we are offering plans with low and even $0 deductibles, which is pretty incredible. Our plans have unlimited primary care and specialty care visits with flat dollar copays that are not subject to the deductible. We have flat dollar costs for services that are not subject to the deductible, like MRIs, labs, and x-rays. And the new split deductible option, Nan, maybe you can speak a little bit to that, the new split deductible option, to explain what that is.
Yeah, so with some of our plan designs, what we mean by this is that there could be trade-offs, if you will, with, say, a higher deductible, co-pays or co-insurance for drug coverages. So it really just relates to what you're going to see are quite a variety of how these plan designs actually could fit for your situation, your individual coverage, and your dependents and your families. That's really what we mean by that.
And then the next bullet point 2, Nan, the HSA plan that's offered off marketplace is a little bit different. Can you explain that as well?
Yeah, so a health savings account, if you've heard of that. So these are like high deductible health plans. We have those as well. They happen to be offered off of the marketplace. So some companies will actually offer on marketplace, on the Colorado Exchange, and then off. So we do have a plan. So that's good to meet needs of someone who would like a health savings account. It happens to be off the marketplace, which does mean that there wouldn't be any premium credits. For those of you that might be familiar with that, the federal government actually gives some premium credits for up to folks that make up to 400% of the federal poverty level. So the credits are available on the marketplace, but not off. But again, just a variety and flexibility of the plans.
And then another large part of this plan that I think we worked really hard to have included were these enhanced mental health benefits. So we are doing that by improving capacity in our mental health system. So that means that the providers that are in our area, so mental health providers, are going to be reimbursed at a higher rate than what normal plans available in the marketplace in the past have been. So that means, I'll just put that into terms that you can understand. So if your therapist was normally reimbursed by an insurance company $40 for a session, maybe they weren't able to actually make ends meet by taking only insurance patients because they only got reimbursed $40. Our plan will reimburse them. I've heard from some mental health providers actually closer to what their non-insurance rate is. And so that kind of feeds into the community by reimbursing the mental health provider at a better rate, then they're able to take more clients with insurance, specifically with our plan. And that means that we can provide mental health benefits to more of our community members, which I think is a huge deal, because part of the problem with mental health in our society is that it's not affordable to most people. So there are some zero deductible or low deductible plans for mental health, flat dollar copays. I'm sorry, no deductibles, but flat dollar copays for the mental health benefits that we have. And then we've expanded our mental health network. So we have a lot of mental health providers that are in our network. And if you know of a mental health provider that you would like to be in our network, or you are a mental health provider that wants to be in our network, you can contact Elise directly, or you can contact any of the steering committee members, and we can get that mental health provider into our network. We also have worked really hard to reduce the prior authorization hassles. So that means that when you are approved to have mental health benefits, that you won't have, the therapist shouldn't have the issues with having to call in and continue to get authorization to let somebody be seen. And that goes along with the increased access to mental health, which in our plans, there's unlimited number of visits for outpatients. So some plans have, you can only see somebody 10 times in a year. Our plans don't have that. Like I said before, the flat dollar copays range from $0 to $50 per visit, depending on which plan you choose. And the mental health benefits are not subject to deductibles. Nan, do you want to speak on the premiums?
This is her most
Which is the
exciting
coolest part of
slide.
this.
I get the
You
most
have to
exciting
sign.
slide. Thank you. So this is a snapshot of the types of premiums that we're looking at from all of this hard work. The first two lines, you'll see it labeled Bright Peak and Bright Southwest Health Alliance, or SHA or SWA, same thing. And then the next three lines are actually folks that are in the marketplace now, actually carriers, right? So we do have Friday, Anthem, and Rocky Mountain. They're in the marketplace now. What we wanted to do was to certainly show a comparison of where we landed from all this, wonderful collaborative work together. So the first column there is actually what's called a catastrophic plan. That's a plan that's actually available up to age 30. And then the next four columns, those actually are rates. This is age rated, so we actually picked the rates for a 40-year-old non-tobacco user. So those are the monthly premiums that you would see for bronze, silver, couple silver plans there, and a gold plan. The gold actually are the quote-unquote richest benefits. So we have several of those that you can review. And then the silver plans, middle of the pack. Bronze would be the least rich. But you can see these rates here. To see a premium that starts with a 2 that isn't $2,000 is a very good number. So we have, quite a few that are in the, sub $300 range. It does depend on the age. So of course, as we get older, stuff costs more for it, and we typically have more use for healthcare. So again, this is a snippet here. We do still have our footnote there that, as Monique mentioned, these are close to being or are approved by the Division of Insurance, It's any day now. Officially, the word, will be out, but we're 99.9% sure and confident that these are the type of premiums that you would see. So really unbelievable. So where are you going to find these? We certainly recommend go to your broker, or if you don't have a broker, we have a list of brokers locally, and then also ones that have been what we call preferred brokers. So those are listed on the Peak Healthcare website. And that means that the brokers actually went through some additional training, and we certified them, if you will. They didn't pay to be on the website. We actually offered that up, and we're very happy to actually connect you to any of them or any of our brokers locally, in Durango. We have a couple that are actually preferred in Durango as well, but any broker can help you with this. So this is just a snippet of what the really kind of the screenshot would look like on the exchange. So this is where you find the rates, and actually it's starting November 1. The plan designs and the rates will all be loaded and out there. But what we wanted to point out here is that you're going to see Bright Health, you're going to see that logo, and the Southwest Health Alliance. And then in the areas where Peak is, which all this is part of Peak, you're going to see the Peak logo that as well, right? So more of the northern part of our state. And then a really cool thing is that typically these plan designs line up on Connect for Health Colorado based upon the lowest premium to the highest premiums. So we should see Bright and Southwest Health Alliance and Peak all over on those first couple pages. We haven't seen that yet, but that's usually how these things are rank ordered. So really good, and you can start seeing what type of premiums you can have for your age and your area code, or zip code, sorry.
All right, so I know we have quite a few business owners on the call, and maybe what we could do, because we have so many knowledgeable folks, let's have Elise start with ICHRA, and then Susie and Nan can help provide their perspective. Does that work?
Sure.
Hi everyone, I'm really excited to tell you about ICHRA. ICHRA is the group coverage option that Southwest Health Alliance will be offering for 2021. It stands for Individual Coverage Health Reimbursement Arrangement, which is a bit of a mouthful, so we'll refer to it as ICHRA. The premise of an ICHRA is this: you as a small business can choose a set amount that you want to contribute to your employees' health insurance tax-free. Your employees then have access to that tax-free contribution to purchase a plan on the individual market. The reason this is so exciting is because it offers A, affordability, and B, a lot of flexibility for you as the employer, especially in a COVID environment. So to give you an idea around affordability, we've been talking a lot about the individual market, and that is the core of what an ICHRA is. The rate differential there is pretty significant, and historically businesses like yourself just haven't been able to take advantage of that rate difference. So the individual market in the western slope of Colorado specifically is about 20% lower than small group rates. So by arranging an ICHRA for your employees and offering that contribution for your employees to purchase a plan on the individual market, your dollar is going a bit farther. On the flip side of that, for your employees, by receiving that tax-free contribution and then using their ICHRA to purchase a plan, they have any of the options that Susie and Nanette have mentioned on the individual market available to them. So they can enroll in any of those bronze, silver, gold plans, and they decide what coverage they need rather than you choosing a plan.
I think that, hi Elise, I think that it's important to point out, because I think that that's a good explanation, but the reality of it is when you're a small business, you can designate a certain amount of money that goes towards your employees for their business. So they would go out and purchase a plan on the exchange, and you would decide, you can develop certain classes. So you can develop classes of employees like seasonal, part-time, full-time, any kind of class that you want to, you can create. And then you can decide. So you can say, I want to put, towards my regular full-time employees, I'm going to put $500 a month into their ICHRA. And so then they go out and they purchase a plan on the marketplace. and then you actually hire this third-party platform that has a nominal fee, and they're the ones that administer this plan for you. So they make sure that you're kind of all within legal guidelines of doing this, since it's on a pre-tax basis. But your employees can use that for premiums or for other healthcare expenditures. And so it takes away, like, you don't have to do all that administration that you would normally have to do if you had a plan. You still use your broker, but you get to decide. So say you put $500 towards towards your full-time employees. You could put, say, $300 towards your part-time employees, or you could do $100 towards seasonal employees. So it's an awesome retention benefit for employers to have, and you get to choose. And so I think what's really important about this is that you get to be the one that dictates the cost that you're going to pay towards health insurance, and you get to make sure it's budgeted for yourself, so that you know what it's going to cost. Because if we are just if we're just taking plans that are on the marketplace, then we're kind of at the mercy of how high they could go up in a year or two. So they might raise by 20%, and then your budget is blown out of the water. Whereas with an ICHRA plan, you get to decide. The other thing is the employee gets to take the plan with them when they leave. And so you don't have to worry about all that paperwork around, making sure that you've taken them out of your system and all that. And the brokers, like Nan said, the brokers that are in town, we've worked with them so that they understand these plans and can help you set them up. Elise, go ahead.
Okay. Yeah, no, I think that's a great clarification. And so just to, underscore your point, it gives you as the employer a lot of control. So the contribution is very much in your control. There's no minimum or maximum contribution. So that's up for you to decide. And then the employer gets to choose the plan, and the employee is really the policy holder. So it's changing that a bit. So you as the employer are paying your employee rather than a carrier, and your employee is selecting the plan that's best for them. So Susie, you referred to the platforms a little bit, and I just want to touch on that a little bit more because they are pretty important. On the enrollment side of things, if you want to pursue an ICHRA for your group, both brokers and platforms are important, as you mentioned, Susie. So we do have a list of preferred brokers who have taken extra training to be preferred brokers and know quite a bit about ICHRA and are ready to help with that. They will have a relationship with a platform. These ICHRA administration platforms are kind of where it all happens. So that's where you'll upload your census. That's where you can get a feel for how far your dollar can go. Okay, if I want to contribute $300 a month, what does that look like for my employees? So you can kind of get a feel for that. You can have a broker guide you with that, or you can work on a platform yourself. And then on the flip side, that's also where your employees will go to redeem their ICHRA, if you will. So that's where they'll go to say, oh, Joe Sandwich Shop gave me $300 a month. Let's see what my options are. And we here at Peak and Southwest Health Alliance are also always available to answer any questions.
Next steps, Nan.
Yeah, actually, even before this, I thought I might share a couple of our examples.
Oh, yes.
Where we actually had like a real life small groups, right? So I won't tell you the names of the groups, but they provided their census to us and actually what they're currently paying for health insurance. This is on a small group plan. So one of them is a group of 11 employees, and their current premium is about $10,000 a month. So that's all in. That's the employer contribution and what the employees pay, $10,000 a month. And that's for really what we call a level of a silver plan. So with the Southwest Health Alliance products, these Bright Health products, we actually compared to a current silver plan, or what you could get on a silver plan, and the rate would go down to about $6,000 a month. So when you hear that, more than 35% savings, it's definitely flowing through there. That's actually more than 40% savings. For that group of 11 employees, that would be over $50,000 a year. And what's even better is that if they continue to pay what they're paying now, they actually could get our richest gold plan. So those individuals could actually have richer coverage than they have right now through the small group plan. And this is all because of the advantages that we have with the individual coverage with both the state reinsurance and then all of the work that we've done to bring down the premiums even further. So that ends up about $4,500 an employee Then another one was a group of 5 employees. They pay about $2,500 a month, and they can get a little bit richer benefit as well for about $1,600. That actually clocks out right at a 37% savings. For them, that's over $11,000 a year savings, and that's 1 year, with coverage, which actually, can be better coverage than what they have today. So very powerful, and that actually includes the cost of using the platform. So the platforms cost about $15 a month. The employer group does pay that, but it's nothing, it's peanuts compared to what the savings are. So we mentioned this before, the open enrollment for individuals, that starts November 1. That's on the Colorado Connect exchange, and that actually goes to January 15th. So those are for individuals. Groups could actually enroll in this throughout the year. They're not just in this window. So when you talk with your broker, you can talk through, ways that you might want to actually even move off cycle to save monies on this. Again, we're very much endorsing our local brokers. If you actually talk to one of your local brokers or one that and they're not aware of all of this yet, please put them in touch with us, because we'll be happy to actually connect with them. Lisa's doing a fabulous job talking with all of our brokers, and we're helping out as much as we can down here, in our Southern Colorado area. And I think the next one is who we want to thank for sure.
Yeah,
Monique, do you want to say?
I'd love to take this one. As you might imagine, pulling something like this off is no small feat. And I know Peak Health Alliance spent hundreds of thousands of dollars to get this up and running in Summit County. And thanks to them, really working in the broader Western Colorado region, we've been able to, for a much, much smaller amount, be able to work with them and have their expertise to get this up and running. So we've been fundraising locally to make that happen, and all of the logos here are either local governments or businesses that have made a contribution. So I just want to thank the local community for that, because that has literally been dollars that helped us basically pay Peak, which is a pretty nominal fee, but still, a fee that we had to raise here locally to make sure we could get all of this work done. And then, of course, staff time. Basically, I'm kind of the one staff person at Local First Foundation that's doing this, and all of the steering committee members that you're hearing from today have been volunteering. So thank you for that. And then just some contact information. Elise, if you could put your contact information in the chat, that would be great. Nan and I have been kind of giving most of the presentation, so our contact information is here, but really anyone at the Peak Health Alliance or Southwest Health Alliance is available to talk with you. And we should do questions in the last 20 minutes here. I see one question that we could just start with. So somebody who missed the first bit of the meeting, they're wondering what the coverage is for out of our area. So specifically around specialists based in Denver and Aurora. Where can I find a list of participating providers? So maybe Elise could start with that, and then if anybody else wants to chime in, we can.
Hi there, great question. So I just want to, this is an ACA compliant plan, which means that it does meet network adequacy. In terms of providers outside of the area, the entire Centura statewide system is available to members. So any of the Centura facilities across the state. We've also contracted with some additional facilities. So Children's in Denver is a network for advanced pediatrics, for example. And for any tertiary care that Centura is not able to do, we do have a contract in place with the university.
Okay, and then another similar question about dental coverage.
Great question. Since these plans are ACA compliant, they will have pediatric dental. So pediatric dental coverage for kids up to age 19, and that carrier is Liberty Dental. However, these plans do not cover adult dental, so you'll get that how you historically have.
Great. And then if you have a question at this point, you can go ahead and put it in the chat, or maybe since there's about 50 folks on the call here, you can raise your hand and we can try to moderate that, because it would be really great to just get a Q&A recorded so we can share this with other business owners and individuals. So feel free to unmute yourself and ask away.
Oh, I just saw another question pop in, and since
Okay.
it's about providers, I'm just gonna piggyback to what I just said. And the question is a list of participating providers available yet? Bright does have a provider search on their website that is up and running and live. As we finish with credentialing and contracting of providers, it's continuing to be loaded. So it's not yet complete, but you can start taking a look at that.
And then there's a question about whether the program is available on the Front Range, like Colorado Springs. I had a slide earlier that showed the counties, which does not include Colorado Springs, but maybe Elise or Tamara can speak to that. Tamara.
Yeah.
There.
So Peak started in Summit County, and with the partnership with Southwest Health Alliance and then Peak's other expansions, we are currently for 2021 going to be offering coverage in Summit, Lake, Grand, Montezuma, La Plata, Dolores, and San Juan counties.
Good job. And then somebody's asking about, I couldn't find the plans yet. Great point. Thank you so much for bringing that up. So open enrollment starts November 1st. That is when you will start seeing the Southwest Health Alliance and Bright Health logos and the plans, which would be available for coverage starting January 1st of 2021. So please do not get discouraged if you go today and do not see the plans yet. In fact, I think on November 1st, we'll send an email blast to everybody that's on our list to say that's the day that you'll start seeing these.
And I would add to that the brokers that are appointed with Bright, they're telling us that they actually can provide quotes, or they can access through Bright. So so you might want to go ahead and contact before 11/1, but then certainly all of us consumers ourselves can get onto that website on 11/1. But you might want to contact your broker now. They could give you some information.
Other questions? Comments? I'm going to stop the screen share for a second so I can see everybody on the call a little bit more clearly. Don't be shy. I'm going to have the awkward pause for just a few more seconds because there's a lot of people on the call.
So I'm wondering, how do we get you our email so we can get notified, so you can send us an email when it's out there?
Yes, please put your email in the chat box to everyone. If you're not comfortable with that, you can send it to me, which is director@local-first.org, and we'll put you on the list.
Okay, thank you.
If Maritta's comfortable, I'd love to hear J-Shore Agency, Maritta, to tell us what you're thinking so far. Unmute.
I'm scrolling through to see if they're still muted.
I just put on.
Okay, other questions or comments?
Can she unmute herself? Or can you unmute her, Merida?
I'm looking. Oh, that's interesting. Another person. Maybe they dropped off. Another person just admitted themselves. Yeah, I don't see them, Nan. So. Okay. Yep. Other questions?
It's under Merida. It's under Merida. If you can look on the
And she's on video.
Merida-broker.
Oh, there she is. Okay.
She's on video. Yeah.
Ask to unmute. Feel free to chime in if you'd like.
While you do that, this is Claire. I would like to reinforce what Nan has just said, and that's that while the rates aren't up on the public site yet because of Department of Insurance regulation, et cetera, if you are interested in this and you have an existing broker, feel free to reach out. And if you don't, I would definitely encourage you don't need to wait till November 1st to select a broker from the list of already trained Peak preferred brokers if you don't have one, because they can start the process for you. You can get lots of information between now and November 1st when those rates are up. So I would strongly encourage, if you're interested, you don't necessarily have to wait.
Yeah, great point. And we don't want you to wait because we want you to shop local for healthcare as soon as you can, and to be informed as kind of the non-healthcare person in the group, I can tell you that for all of us to educate ourselves on what the healthcare system looks like, why the Peak Health Alliance health insurance cooperative model has been able to kind of break open that system. And now it's up to us, right? Now it's our time as individuals or business owners to shop local, to understand what the choices are among all the different carriers, right? And it's only if all of us do that and become part of, I'd say, that voice by shopping local for healthcare that we can be successful into the future. And I will say on one of the other calls, the Durango Chamber call and webinar, I had somebody ask, like, well, who's gonna make sure that all of this great news continues into the future? It's really gonna be a partnership between the Local First Foundation, our Southwest Health Alliance Steering Committee, and Peak Health Alliance to keep this work going and to keep improving on it year after year. But it won't be meaningful unless our community, gets informed and ideally gets healthcare coverage and potentially chooses to shop with Southwest Health Alliance and Bright Health.
I had one more thing to add, and that's that many of you might get renewal notices. The rates in the Southwest, in part because of the presence of Southwest Health Alliance, and they've raised a little bit of fear. So you'll see the rates from all the carriers have gone down a little bit. And one of the things we learned in Summit was that the existing carriers sent emails out saying, hey, auto renewal, go right now. We actually dropped our rates for you. And many employers said, wow, that never happens. And so they were happy with the 2 or the 3% rate reduction that they were able to lock in early. And if they had paused for a brief moment and looked at the overall market offering and seen that they could have gotten 20% savings or more by waiting and shopping a little bit. So I would strongly, many of you may experience those emails, and it's so stunning to get an email that says your premium went down that, I understand the instinct to say, wow, this is easy, I'm just gonna stick with it, but it does pay to shop.
Hi, this is Merida. Can you guys actually hear me now?
Yes,
Yay! Wonderful. Thanks everyone for all the work that you've done. I would declare, just totally agree with you. It's very, very infrequently that we'll see rate decreases, and it just sort of speaks to the work done and the kind of behind the scenes, what the contracts are held and what we're actually paying as consumers sort of in rural areas. We're absolutely starting to see traction with ICHRAs. I really do believe that that's a really neat option, especially for our small groups. Let's say under 20 employees, which as we know is most of Durango. It's just that small group, let's see here, individual rates are competitive. And now we have an ICHRA. This is the new thing. ICHRA's just sort of hit, they were approved in December, where you as employers can help pay for individual premiums. So it's not like, oh, it's new news about rates. It's just that it is a way to access and help employees pay for the funds. Elise has been doing an amazing job getting networks together. And guys, I think it's a little confusing for consumers, because what we have is the alliances and then the carrier. So you guys, your health insurance card will say both, and Bright Health is the actual carrier, and they're excited to be here, and they've been around for a bunch of years now, and certainly have operated in lots of different parts of Colorado. And so we kind of have this win-win with a carrier to help process things, and then our local team working with the boots on the ground, working with provider contracts. So I am thrilled to see the actual rates did come in as more competitive. It shows that there's room to wiggle, and it actually kind of poked the bear. There's some bigger kind of behind the scenes things, or look, I love your little smile, Monique, where it actually influenced bigger carriers and what they're doing here. So I'm just super excited, and open enrollment is right around the corner.
Thank you so much. Love the enthusiasm about healthcare. That's really what I was smiling about too, because it's so exciting.
Did I show the sign?
Yeah, go ahead. We can end with
Merida, you might want to put in the chat, maybe you could put your contact information. Merida is a broker that is one of our preferred brokers, and so you can contact her directly if you don't have a broker and you have questions or want to get people signed up for this plan. I think that's really important that Merida is here and available for you to help you.
All right, we'll end with Nan's son.
Here's what we hope everyone comes away with. And when have you ever said you're excited about health insurance, right? Southwest Health Alliance, Bright Health, Peak, right? Are you excited? We are, and I never thought I would be writing something like this.
Awesome. And then I just posted the actual like sub-page site where this webinar is going to be. So if you missed the beginning of it, or if you have folks in your businesses or communities that wanted to see it, we'll also send this around to the list, which I was mentioning as everybody was hopping on the call. At Local First, which is obviously a subset of the broader community, we had 274 people interested in the Southwest Health Alliance, and then we sent out an email with Peak Health Alliance, and that list went up to 444 in about 9 days. So that's pretty cool. So I think the word's out there, but certainly we need to be doing more education. So all of you know, this question came up a couple times. We are presenting in Dolores, San Juan, and Montezuma counties. We're hoping to make sure that all of the counties understand and all the individuals in those counties understand what we have to offer. And if we're not able to get out to your community, then just know that this website will have quite a few different webinars that you can watch in the comfort of your own home. So thanks.
I think it's also important, and I always say this, Monique, but this is a huge deal for individuals in our area. We have so many uninsured people in our area. And these plans are affordable in a way that we haven't had access to in our community before. So while a lot of you are from small businesses or from businesses in our community, I think it's really important to spread the word and let individuals know, because there's a lot of people. I was at a appointment recently with a body worker, and he said, wow, I pay more than that for a catastrophic plan right now. And he's an active, you know, in his 40s type of a person. And he's like, you mean I can actually have real health insurance? Like I can actually go to the doctor and things like that and have a copay. And so I think it's important that, you know, we're all from a business community. And when we come on this call, that's what's kind of brings us all together. But to understand that getting the word out to individuals, however you can do that, is really, really important, because I'm not sure what happened in Summit. I can't speak to that, but I know that they were able to cover a lot more individuals there. And I'm hoping, I think our whole steering committee is hoping that we can pass the word on to the individuals in our community that don't think that they have an option for health insurance.
Yeah, I've heard the same thing, Susie. I had one person in particular who was just so excited because she was like, oh, I'm actually going to shop for healthcare this year. Like, it's always just outside of any reality for me financially. So that is really exciting. Okay, well, thanks so much to everybody on the call. Thanks for joining us. If there's no other burning thoughts, we'll give you 5 minutes back of your life today, and appreciate you spreading the word and taking the time out today to learn more about the Southwest Health Alliance. Have a great rest of your day.
Thank you.
Bye.
Thank you.
Thank you.